Hello, 𝗚𝗏𝗀 here. Today I want to talk about a topic which hopefully will help you understand the changes in your face throughout the healing of your facial paralysis, and depending on the stage and what happens. People feel a lot of different things and symptoms from one stage to another, and there are some reasons for that. So first of all, your facial nerve coming from here and around there splits into 5 main branches, but truly there's thousands of branches from those branches all over your face, going to innervate muscle that will produce movement of your face and movement of your skin, because these muscles are embedded in the skin. They do not attach to bone. They are just free floating and just smooth skin when they contract, versus other musculoskeletal muscles, just like your biceps or your quads. Those are firmly attached to bone and are moving a joint. This is just moving skin on skin. For what I was actually staying on topic or trying to, gonna talk about with facial paralysis, when you have acute facial paralysis, and if you are in the flaccid paralysis stage where you have no movement, and basically, if this was my paralysis side, this is what would happen. Your eyelid doesn't close, your eye is wide open, and you have a massive droop of your face, as well as obviously the lack, for some people, not everybody, lack of movement up here as well. So in this stage, the flaccid paralysis stage, all of this is overstretched. It does not contract, so you have an inability to bring it back here even when you try. And it's not something to try and work on, because you're not going to go anywhere. All you're going to do is you're going to create more tightness on your strong side. So I would avoid that. At that stage, you feel everything is overstretched, so it's not very tight. Or if you stay like this for a certain amount of weeks, your good side is going to get tighter and tighter and tighter, and participating in that asymmetry because it's pulling you this way, right? As the nerve starts healing and you are moving into the paralysis stage, where you're starting to get a little bit more tone. So you could still be slightly like this, but at least there's a little bit more here. It's not as severe as this. So you're getting more tone back here. And what happens as the nerve continues healing and you are getting more contraction of those muscles, this, because it's becoming tight as well, because it hasn't contracted and produced a movement for several weeks or sometimes months, and that's also tight. And as you get the tone back here, you're gonna have the opposite happen, where this and going to this side. And this is if you're not stretching this. Let's say if you have had Bell's palsy and it hasn't healed in 3 weeks to 3 months, and even maybe if you're on the 2nd or 3rd month of no movement, you're gonna be tight here. And generally it's this whole area where this. Now, if you don't stretch this and you happen to take even longer to heal and end up developing syncytial, if you have not stretched this, this is gonna reinforce your syncytial and make your appearance and make the quality of your movement much worse. So this is when facial therapy is key in preventing those asymmetries and helping you get back your face to at least symmetrical at first, and preventing then this from happening, because that can happen. And just to tell you that, you know, if you're going to your GP and doctor and they're telling you there is nothing else you can do, you're just gonna have to wait it out. That is not true. This is what I do for a living. This is what a few numbers of physiotherapists around the world are doing. Physiotherapists, there's also occupational therapists and speech pathologists that are actually also facial therapists and are doing as good of a job at helping people with facial paralysis. But just to let you know that there is something that you can do. There's all these things to work on. Working on the strong side that becomes tight, so stretching this to help return symmetry here, as well as some massaging and light stretches here to help stimulate that area, because if that area has been overstretched, not contracting at all for several months, your brain is losing the memory of contracting this, and that's not good. If you are including some movement, moving the soft tissue with massages and stretches, you are helping your brain remember that, hey, this is still attached here. So that's one thing you can do even in the flaccid paralysis stage. Of course, techniques and stretching around of the eyelid to, again, number one priority, being able to close your eye just to maintain an healthy eye, because otherwise you could have complications there, lose your vision, and have a ton of other complications with the eye. So yes, there is stuff that you can do. I really hope that if you have been diagnosed with Bell's palsy very recently, that you're catching me at this moment, me telling you this now. There is something you can do. Don't sit at home, just hoping for the best. You can massage, you can use a heating pad, you can stretch. There are very many different ways to stretch. Some much better than others. You might need help coaching for that. This is what I do. And then as you're regaining movement, working on movement and improving the movement quality, the control, the precision of that movement. This is what facial rehab is all about. And preventing, if you end up with synkinesis, preventing that synkinesis from getting worse and helping separate movement of your face that are so prevalent with synkinesis, such as this thing, and feeling your eye constrict every time you move your mouth. So I hope you're finding this early on in the process. That's always better than later. It's also never too late. I see patients every week that have had synkinesis for sometimes years, sometimes decades, that there are things that we can help them with and that we can work on. So I hope that was informative, and I will catch you later, hopefully with another post within the next few days. Take care.